Okay, so once we have our below the knee or transtibial patient fit with their protector, and again, this is the device that we're going to put on after the amputation, and it's going to do really three main things. It's going to help to keep the leg straight, to keep the knee from getting a contracture. It's going to provide gentle compression to the residual limb, and it's also going to provide protection. And that's really the biggest reason that we want to wear this, is in case the patient gets up in the middle of the night, tries to take a step and forgets that they don't have their leg that's been amputated. It'll protect the bottom as the leg is healing. So once we have it all attached, I want to go through of how you take it off and how you put it back on. So one of the things with this style protector is there's a lot of adjustability with it. So as the residual limb starts to shrink or the leg gets smaller, we can change the size and accommodate and make the protector smaller as well. So when we're taking this off, there's a lot of Velcro, and what I'm going to do with this bottom Velcro piece is I'm going to keep it attached on the back, but I'm going to take those other sides off, and then I'm going through and taking one strap off at a time, which will open up the front of the protector so that you can have access to the leg if you need to make a dressing change or do any of those things at all. The patient's always going to have a post-operative sock that's going to be put on. So that's going to be an interface in between the protector and the skin, just to make sure that we're not having any skin irritation or breakdown, and it helps to wick away perspiration so it's a little bit more comfortable. So when we're taking it all the way off, so if the patient needed to take the protector and wash it, you can take this pad off, and really the rest of this should stay attached. You shouldn't take it all apart. You can hand wash it, soap and water. There are these plastic stays that are on either side, on the medial and the lateral side of the residual limb, okay? Those really don't even need to come out either. You can take them out if you want to while you wash it. You just need to slide them back in. But the rest of all these pieces that are Velcroed on, you really don't want to take it all apart, because if you do, you won't know how to put it back together. So keep all that attached. So when you're putting it back on, what we're going to do is we're going to slide this underneath the residual limb, and we have one main strap, this longer strap here, that is always going to come right over the kneecap or right over the patella. And that's how you'll know that the protector is on in the right position. Very often what I'll see is we'll have the cup that's put on, and then we'll put the blue aspect of the protector all the way down at the bottom, and it's wrapped around. And what that is doing, this strap is now over the knee. The problem with that is that it won't help to keep the protector from sliding down. So you always want that strap to be above the knee. And to do that, when you're putting this on the residual limb, you're always going to have a little bit of gapping between the blue part of the protector and then the big pad at the distal end or at the bottom. So when I put this on, I'm going to make sure that these stays on either side are right on the medial and on the lateral side. And I'm always going to start with the strap that comes right over the patella or right over the kneecap. So I'm going to wrap this around very snug, and then I'm going to come down distally to tighten this strap. I'm going to then work my way up above the patella or above the kneecap. And again, all of these straps can be very snug because it's not just one strap that we're pulling over. We don't get a tourniquet effect. We're not worried about cutting off circulation to the leg. The last strap we're going to put on right here is the one that comes above the patella. And again, that is used for suspension to make sure that the protector is staying on. And then we're going to come down here distally to the bottom. And this is our final step when we're putting on the protector, is we're going to wrap these straps medially and laterally and then over the anterior aspect. And now we're right back on nice and snug. If I pull on this, it's not going to slide off even when the patient is up and standing and moving, because we have that strap right above the patella and providing what we call supracondylar suspension, so it won't slide down. So again, big things to remember. There should always be some of the white pad that you can see when you come to the end of the blue part of the protector. And you always want to make sure that this longer strap is above the kneecap, and that keeps the protector from sliding down.